Welcome back. In today's video, we are going to study about the morbidity indicators. It is a continuation of the indicators of health. Morbidity indicators is known by the following factors. Morbidity indicators will supplement the mortality data. It is used to describe the health status of a population. They have their own drawback as well because they tend to overlook the large number of conditions which are subclinical. We know that the hidden part of iceberg of a disease. Most of the undiagnosed cases come under this criteria. So it is not a very good statistical data, but it is having its own drawback because it is not covering the undiagnosed cases. Now let us see what are the various morbidity indicators. We have incidence rate. Incidence rate is nothing but the number of new cases in the community. The prevalence rate refers to the new plus old cases in the society. Attendance at the OPD. So we know how many patients attending at our OPD will help us to get a statistical data of the deceased individuals. Okay. Then we have admissions in IPD, duration of the hospital stay of that individual, and the notification rates. That is, you maintain a record of the total number of people and you notify it to the higher authorities. So in this way, we can determine the morbidity indicators. Morbidity is nothing but the disease. Moving forward, the third indicator, the first mortality and the various subtypes, the 10 of them, like we have studied about the crude death rate, expectation of life, age specific death rates, infant, child, maternal, disease specific, proportionality, case fatality, all these have been described earlier in the first video. Now we are moving, then we discussed about the morbidity, mortality done, morbidity done. Moving on to the disability rate. So what does this disability rate means? Disability rate is related to the illnesses and the injuries which have come into use to supplement the mortality and morbidity indicators. Like how the morbidity indicators was a supplement, similarly disability is also acting as a supplement to the morbidity and mortality indicators. They are based on the idea that the health is a full range of daily activities. We know that to consider a person healthy, it means that he should have a full range of the daily activities has to be performed by him. If there is disability, he cannot perform them. So these disability rates, they have categorized them into two groups. We have event type indicators and the person type indicators. Event type indicators deals with the days, okay? Event type. Event is related to that particular event. So we have days of restricted activities, the bed disability days, work loss days. So because of this disability, how many days you are absent from your work, how many days you stayed in the bed, how many days the activities were restricted, these all are related to that particular event which led to the disability. Moving on, the two categories, right? We have event type and person type. Person type indicator, there is limitation of mobility. He is confined to his house. Also he could be confined to his to the wherever the hospital or wherever he is admitted. The special aid in getting around either inside or outside the house is confined. He could be confined to the bed as well. Moving on, limitation of activity. Limitation of activity could be a limitation to the basic activities of the daily living, like eating, washing, dressing, going to the toilets, moving about, etc. The limitation in a major activity includes the ability to go to a work or ability to perform the household work. It includes the person type indicators. There is mobility and activity. Moving on, there are certain disability rates which have been given here. The disability indicators are daily. In the first one we have daily. Disability adjusted life years. By the term disability adjusted life years, you understand that it is the disabled life. So, the years of a life which is lived with the disability. Let us consider an example. There is 100 years an individual is living. He met with an accident at the age of 20. There was some accident. So, let us mark with red color. So, this was the bad thing which happened at the age of 20. Then, moving further, he got the treatment at the age of 60 years. So, happy treatment, okay, smile here. So, 60 at the age of 60 he got the treatment done, and he expired at the age of 100. Now, let us see. Disability adjusted life years is the number of years the person had to live with the disability. That is how many years he was disabled. He was disabled for the period of 20 to 60 years. That is, for a period of 40 years he was disabled. Moving further, we have disability free life expectancy. In disability free life expectancy, it means the normal life, which is nothing but the total life of the patient minus the disabled life. It shows how many years he was free of that disability. Let us consider again. 100 years the person lived. 20 years he met, 20 years at the age of 20 he met with an accident. 60 years got the treatment. So now disability free life, you see how many years was the disability free life? From the birth to 20 years. So 20 years plus during 20 to 60 he was disabled. He was disabled. Here total 20 to 60 years he was disabled. And he lived up to 100 years. So plus 40. We get total number of disability free life was 60 years. He was disability free. HALE, health adjusted life expectancy. It means the years total life that is led by the patient, the normal life plus his disabled life, which is nothing but the total life of the patient. Health adjusted life expectancy. What do you mean by life expectancy? That is total life the person had. The years of the life without disability. How many without disability we saw? It was 60. With disability it was 20 to 60 period was 40 years. So the total life lived without disability was for the period of 60 years, and years lived with disability was 40 years. Total life he lived was 100 years. Makes sense? Next we have quality adjusted life year. The quality of the life has been adjusted here. How are they adjusting the quality of the life? By intervention, by performing a surgery. So I told you that at the age of 20 he met with an accident. At the age of 60 he got his treatment done. So the extra life which was added to him was, he died at the age of 100 years. So extra life that was added was 40 years of extra life was added to his life expectancy because of the intervention. If he wouldn't have got the surgery done, he would have landed up to the grave. So we see that the extra life which is added due to intervention is nothing but that is quality adjusted life years. I hope it is clear. Let us move on. Individually, let us see what they are saying. Disability adjusted life year. What is disability adjusted life? That is the number of years he lost because of the disability. One daily is the 1 year of healthy life lost. Now in that example we saw that how what happened, 20 to 60. So 1 year of healthy life lost. So 40 years he was disabled. So 40 daily is his calculation, because 1 daily is 1 year of healthy life lost. This daily helps us to measure the burden of the disease, and also you can measure the effectiveness of intervention. We saw that, just an example we are considering, he got an intervention done, he got a surgical procedure done at the age of 60. So the effectiveness of intervention was such that he was added 40 life extra life of expectancy. So 40 years was added to his life expectancy because of the intervention. Measures the morbidity as well as the disability. So we saw how many people died because of the disease can be measured by daily, and also how many years the patient was disabled can also be measured. It also expresses the years lost to premature death. Let us consider, if he wouldn't have got that accident at the age of 20, he would have lived up to 600 years. Just because of that accident, for instance, if he died at the age of 60, that is premature death which is happening. Also, it also measures the years which he lived with the disability, obviously. Daily, what if people ask you what is the formula of daily? If it is the question arises, mention the formula of daily. You have to say that daily is nothing but the years of lost life plus years which are lost to disability. Years lost to disability. You lost to disability. You lost the life. So now let us see. Years lost is the number of deaths into expected remaining years of life. So how much expected was the remaining years of life which he lost because of that particular disease, because of that disability. Years lost to disability. Years lost to disability is the number of the cases which are occurring due to the injury into the average duration of disease into the weighting factor. Weighting factor is nothing but which determines the severity of the disease. So we see, guys, the formula YLL, years of lost life plus years lost to disability. Weighting factor is reflecting the severity of the disease. Years of potential life lost, YPLL, years of potential life lost. What do you mean by years of potential life lost? It is because the years of life you lost because of the premature death. Years of potential life lost is a mortality indicator. It indicates the person's death because of the disability which occurred. There was a premature death. He was supposed to die at the age of 60. He is dying at the age of 40. The potential life he lost is nothing but YPLL. So these indicators which I have discussed in detail, it is better for some entrance level exams, for your post graduations. At the UG level, if you remember, the indicators are grouped into two types: event type, person type. In event, it is related to days, that is his bed disability, work loss, restricted activity, and in the person type, his limitation of mobility and the limitation of activity. If you mention this, it is more than sufficient. All these you have to know it, but it is better to confine yourself to this so that you don't mess it up in exams. Moving further, we have disability free life expectancy. In disability free life, what do we see? That the years which the person lived without any disability. It is also known as Sullivan's Index. Sullivan's Index is the total life expectancy minus the duration of disability. That is the total life years of his life, which were disability free. It is a positive indicator. It is also a direct indicator for health and well-being of the society. Now we move on to the health adjusted life expectancy. It not only includes the life expectancy at birth, but also an adjustment for the life spent in poor health. We see that health adjusted is nothing but the adjustment which is made in the poor health. HALE is replaced by disability adjusted life expectancy. Earlier it was known as HALE, and now it is also known as DALE, because they have considered health adjusted into disability adjusted, because it is a disability indicator. Better to mention as a disability adjusted life here. Quality adjusted life here is nothing but the quality years which would be added by the intervention. So it's the same repetition. We saw that quality adjusted life here is the added life. Health adjusted is the total life that the person is living, the life expectancy. We saw it is the life expectancy. It is replaced by disability adjusted life expectancy. Moving on, nutritional status indicator. From this, it's very important, guys. A very short ones, we can do it very quickly. We have nutritional status indicator, which is also a positive health indicator. It is an important indicator of the health status. We have anthropometric measurements of the preschool children, that is the weight, height, mid-arm circumference. You see, mid upper arm circumference. And the prevalence of the low birth weight, the baby which is weighing less than 2.5 kg. Heights and sometimes the weights of the children at the school entry can also be taken as an indicator for the nutritional status of that area. Moving on to environmental indicators. So you see that the environmental indicators will include they will include the indicators of noise pollution, air pollution, water pollution. They will reflect the quality of the environment, may it be physical environment or the biological environment in which the diseases are occurring. These will include the indicators which are relating to the air pollution, includes the SO2, sulfur dioxide, soiling index, coefficient of haze, and the water pollution includes the total suspended solids, the concentration of chlorides, nitrogen, phosphorus, and it's how these things are causing the water pollution and what effect it is causing. All these indicators will help us to understand. It helps us to know. It gives us a reflection of the particular current status of that situation. How is the pollution there in that community? What is the reflection of that particular pollution on the health is what is being assessed here. So see, you see the noise pollution, it gives us a reflection how many people are losing their hearing ability, what are all the various other diseases or the conditions which are occurring because of the noise pollution. So these indicators are nothing but a variable which is giving us the reflection of that particular situation and its impact on health. So we see here the most useful indicators under environmental pollution indicators. It also includes the proportion of population which is having an access to the safe water, the sanitation facilities. Example, the percentage of the households with the safe water in the home or within 15 minutes, the walking distance from the water standpoint, from the protected well, the sanitary facilities which are provided in the home or the immediate vicinity. All these come under the environmental indicators. The water quality, the sanitation facilities in the home, in the immediate vicinity, what are all the facilities which are available in the surrounding environment also gives a indication of the health status of the population. Moving on to the health policy indicator. It is an indicator of the political commitment. Here you see that GNP spent on health services. So it is an indicator of the political commitment of providing the adequate resources to the community. The indicators include the proportion of the GNP which is spent on the health services, the GNP which is spent on the health related activities, which includes the water supply, the sanitation, communities development, the housing, nutrition, the midday meals, and all such things come under the health policy indicators. The proportion of total health resources which is devoted to the PHCs also fall under the health policy indicator. Moving on to healthcare delivery indicator. We see that in the healthcare delivery indicators, it gives us a ratio. The ratio of the doctor to the population ratio, the doctor to the nurse ratio, population to the health centers, that is the you could consider a PHC, CHC, population and bed ratio. So we are done with the healthcare delivery indicators. These indicators also reflect the equity of distribution of health resources in the different parts of the country, and also the provision of the healthcare facilities also can be made out and can also be assessed by using these indicators. Moving on to the utilization in rates. Utilization rates is the proportion of infants who are fully immunized. So in the utilization rates, they give us an additional information of the health status of the community. We get to know to which extent the health services are being utilized, to which extent these have been investigated, the coverage of the services. These can be expressed, in the following ways. So we see that healthcare utilization is affected by the factors like availability, the accessibility of the health services. It is also the attitude of the individual towards his health and the healthcare system. So we see that not now most of the health services which are provided by the government are unknown to the rural areas. The awareness about the health facilities which are provided, the various yojanas and those schemes which have been come out by the government are not actually assessed by the people. So these utilization rates also help us to understand the availability of the health services and the accessibility of the health services. It also includes the attitude of the individual towards his health. We get to know what is the attitude an individual is having towards his health and also the healthcare system. So these utilization rates are given below. They are the proportion of infants who are fully immunized, the proportion of pregnant women who are receiving the antenatal care, the bed occupancy rate. The bed occupancy rate is nothing but the average daily inpatient beds, inpatient ratio, the total average daily in IPD patients. Okay, the average number of beds which have been occupied by the patients, and the average length of the stay. It is nothing but the days of the care which is rendered, how many days the patient has been admitted before he's been discharged. And the bed turnover ratio is nothing but it is the ratio of discharges by the average beds. So now let us see what they're saying here. We have bed occupancy rate, average length of stay. Now let us understand bed turnover ratio. Bed turnover ratio is the amount of time that the beds at hospital are unoccupied until the next patient is admitted. So we see that it is the ratio of discharges by average beds. We have discharges by average beds. How many beds are unoccupied is the turnover. Until the next patient is admitted, how many beds, amount of time the bed was empty. Okay. Negative value. If there is a scarcity of bed, it indicates there is overutilization of the services. Imagine the corona times. Okay, there was scarcity of the beds, there was overutilization of the services, which means the health of that community is negative. If there is vacant beds, there is underutilization of the services. It could also, there are two aspects. See, if there are two aspects, just like a coin has two faces, these have a positive value. If the beds are empty, it means no, the health of the community is good and people are all healthy, nobody getting admitted. It means that there is a vacant bed, there is a positive value. Also, it shows that there is underutilization of the services. These rural areas, people struggling, dying there at homes, they do not know, they are not aware, they cannot afford. There is underutilization of the health services. The beds are empty, yet the patients are dying at home. So it has a positive value which indicates the vacant bed, and also there is underutilization of services. When there is a slight positive value, it shows that there is optimum utilization of the services. Next, moving on to the social and mental health indicators. It includes the suicides, homicides, juvenile delinquencies, battered baby syndrome. The in depth of juvenile delinquencies and battered baby syndromes will be dealt in the next videos. For now, you remember that the social and mental health also have the particular indicators. The total number of suicides which are occurring, or suicide is, they kill themselves, and then homicide, that is murders, and then we have juvenile delinquencies, since the breaking of the law, or the unethical practices which are performed by the children below the age of 15 years. Then battered baby syndrome, that is the children which are tortured. Moving on, we have socio-economic indicators. Guys, this it is a very valid point. Okay, it is a very valid positive indicator of this social and mental health indicator. It is very necessary for the indirect measure of the health of the community. We also have the other indicators like alcohol, smoking, and those drug addicts, obesities, drug abuse. And we also have this family violences, like we have not mentioned about this battered wife syndromes is also there, or the neglected abandoned youth in the neighborhood. These indicators will also guide us to the social action which is required for improving the health of the people. Moving on to socio-economic indicators. They do not directly measure the health, but they are of a great importance in interpreting the indicators of the healthcare. That is the housing facilities, the family size, literacy rate, unemployment level of that people, GNP per capita, calorie availability per capita, the growth rate, dependency rate. So we see per capita, calorie availabilities, the literacy rate, especially the female literacy rates is given a much higher importance. Then also the dependency ratio. The dependency ratio, this is playing a role, socio-economic. So you see here, dependent, that is the kids, the children up to the age of 18 or 15, they are dependent. And then we have after the age of 60, 70, that retired period, and this children, both are dependent upon the working individual, that is the productive individual of the community. So we see that this dependency ratio also reflects the social and economic indicator of that community. Thank you. With this, we come to an end.